Hey y'all, I'm Nurse Sheena and I'm back with another video. So today the video is going to basically be showing y'all the setup for a pap smear. Ladies, get your pap smear. They are an annual preventative test. It's cancer screening test, and you can get them annually, or if it's normal, your doctor will let you know if you can get it every 3 years. But today I'm just going to show you the setup and kind of explain, all of the tools that is used when you get your pap smear. Maybe it'll ease some anxiety and all of that. Or maybe you're working in a doctor's office and you need to know how to set up for a pap smear and what everything is for. So I'm just going to be showing y'all really quick everything, all the tools that when I set up for a pap smear and what they're used for. Okay, so here we go. We have our tray here. I'm going to start with these. Okay, so these is what you call a speculum. It's a vaginal speculum. Okay, so this is what the speculum looks like. This is what the doctor uses to get a clear view of your cervix. So these speculums that we have, it come with this little insert at the bottom. Therefore, the provider can put a light on it. It lights it up. So when she put the speculum in, she pops it in place, and she's able to get a clear view of your cervix. So the speculums come in different sizes. The white one, well, the ones we use here, the white ones are the small. The green ones are the medium, and the blue is the large. So depending on your cervix size and your weight, the doctor will choose accordingly which speculum to use. Okay, so also on my tray I have the thin prep. So this is the liquid that your sample will go in. And this is what is sent to the lab, and the lab runs the test. With this thin prep, with the sample here, you can test for STDs. It won't test for HIV, that's a blood test, but it will test for chlamydia, gonorrhea, and trichomonas. It will also check for BV, and I'm not sure about yeast. So we also, on the cart, we have the lubricant. The lubricant will be applied to the speculum. So ladies, it will make it a little bit easier or a little bit more comfortable for the speculum to go into your private area, so she can view the cervix. So she'll put a little bit of lubricant on it, and then she will insert it. Then she will, put it, open it up according to her view. So we have the lubricant. We also have these tools. This one here is called a cyto brush. This, the doctor or the provider will use this to get a sample of the cells of your cervix. And this one is called a broom. This is also used to get a sample of the cervix. So usually they will put it in, get the sample, take it out, and you will put it, you can either cut this off and leave it in there, or you'll scrape it and then the cells will go into the thin prep. And usually when you get your pap smear, they usually use this swab as well. This swab is called an abdominal swab. This is used to test for STDs. So basically, there's a Q-tip in here. The doctor will do a quick swab, and whatever STDs this one don't cover, this one will. So for sure, this one will cover the BV, the yeast infection, and all of that. So the doctor will do a quick swab with a Q-tip, and it will be placed in here, labeled, and sent to lab. Okay, y'all, so all in all, when you get your pap smear done, hopefully this ease your anxiety some. Getting the pap smear, we as women get a little bit of anxiety and all of that, but it's something that we need to do to make sure that we stand on top of our health and to prevent cervical cancer. So like I said, these here, once again, it's called the speculums. You want to choose according to size. You want to also have the light. If you don't have this light, you can set up a lamp by the bed. This right here is the thin prep is what you'll put your sample in. You want to also have your lubricant. You want to have your brushes. This is your broom and your Cyto brush. It's just a quick sweep of the cervix. And then you have your Q-tip and your abdominal swab for the STD testing. And yeah, that's all I have today. So hopefully this helps if you work in a doctor's office and you need to set up for a pap smear, or if it's time for your pap smear. Hopefully this ease a little bit of anxiety. When you go to your next visit, you will know exactly what the tools are. And yeah, I will catch y'all in the next video.